we are CBO, or CBOH stands for Clear Bill of Health, but we call ourselves CBO, and we are a digital health platform that allows users to share health statuses with those that they choose, businesses, friends, and partners. We're focused on COVID in the near term and other transmissible infections and interpersonal relationships as we scale. We believe the pandemic has shown us clearer than ever that health is not just personal, it's interpersonal, and our platform allows users to connect with confidence. Our mission is to destigmatize testing and eliminate the spread of transmissible infections. As I mentioned, we're focused on COVID in the near term and building safety and trust in intimate relationships in the post-pandemic world. So as vaccinations roll out, people really want to meet up and gather again and date. And people currently are relying on trust that new partners and their peers have gotten vaccinated, but they don't actually have a means of knowing that, which adds anxiety and actually the perpetuation of transmission due to the lack of social accountability. And this phenomenon might sound familiar to many of you. There are millions of new STIs every year, sometimes attributed to the rise of anonymous and available sex due to the growth of dating applications. We believe, although there is some questions I've heard in this conference so far, that this is actually going to be exacerbated due to the pent-up social and sexual demand of the COVID-19 pandemic. Controlling for the safety and well-being of users has long been a challenge to dating and social sites. I don't need to tell any of you that. But while it is impossible to control for every scenario, the personal and interpersonal health landscape is largely unaddressed. Our solution fills that gap. CBO coordinates testing information and health status to facilitate safe and comfortable social interactions. Our primary audience is 18 to 35-year-old young adults, and our focus today will be on Kylan, who is moving to a new city fresh from a pandemic breakup of a long-term monogamous relationship. She is COVID conscious, vaccinated herself, but uneasy about new partner statuses. Additionally, she hasn't had the sexual health conversation in quite some time, so she is really grateful to CBO for coordinating that information for her, as well as normalizing the critical conversation that is otherwise uncomfortable to have. What have we built so far? Well, even in a world of mass vaccinations, how are people able to understand who is actually vaccinated or COVID negative? 1 in 4 people in the United States just refuse to get the vaccine. Many else are waiting to see what happens to the rest of us who have gotten vaccinated. And globally, there is a much slower rollout to mass vaccination status. So how do we know that the people who we are meeting up with have taken the proper measures to protect themselves and us? What if you want to know that before you actually meet up with them? So, built by my classmates and myself at Harvard and MIT, and currently under App Store review at the iOS and Android platforms, our MVP is a social gathering tool for COVID-19 vaccinations and testing status. Hosts can create events at the threshold of COVID security, vaccination, and testing, etc., and kind of manage the testing and vaccination proof of attendees. Attendees can upload the COVID vaccination record cards and attend gatherings with a peace of mind, and having eliminated the difficult dialogue of asking for this health information. Long term, our vision is creating a new marketplace for health status shareability. Digitally enabled shared experiences have become the norm, but creating a community where responsible interpersonal health behaviors are normalized for sharing, thereby decreasing the risk of transmissible infections and improving user well-being, is not yet. So our innovative approach is using social technology for preventative health measures. Because sharing vaccinations or results is not appropriate for all types of infections, i.e. STIs, we're proposing a signaling methodology where the user is in control of their data. They share they choose what to share with who and when. All that is shown in the digital health sphere on dating and social applications are statuses, while results remain under user control and their secure personal portals. Normalizing the signaling will enable critical conversations and catalyze more responsible behavior. So who are we? We're a team of students across some of the most innovative campuses in the world, and all are very passionate about bringing a solution to the space.